Welcome to today's clinical case scenario. The topic for today is lower GI bleeding. Now let's go through a short clinical case to demonstrate this lower GI bleeding. A 78-year-old man was admitted for PR bleeding for 1 day. He passed out large amount of bright red blood with clots, after which he felt very weak and dizzy. There is no history of pain or altered bowel habits, and the patient has never had a history of passing blood-stained stool or melena. He is a case of hypertension and suffered a stroke 2 years ago and is on Plavix 75 milligrams since then. On examination, he was quite comfortable, but the BP was 100 was low, 100 by 60 millimeters of mercury. Pulse rate was slightly high with 100 per minute and the volume was poor. The arterial oxygen saturation was 96% on room air. The patient otherwise was alert and comfortable, and there was mild pallor. The abdomen was soft but not distended. There was mild tenderness and guarding at the left lower quadrant. Otherwise, it was normal. Rectal examination revealed large amounts of fresh blood with clots, and proctoscopy was not useful due to poor visibility. Okay, now let's analyze this case scenario in a bit more detail. Okay, in the history, we know he's a 78-year-old man, bleeding PR for 1 day, large amount, fresh, bright red blood with clots, after which he felt dizzy, and history of stroke 2 years ago, and since then taking Plavix, which is an antiplatelet. Okay, this is the important features in the history. In the examination, he was pale. There's tenderness and guarding at the left lower quadrant of the abdomen. And then a rectal examination revealed fresh blood with clots, and his vital signs were borderline. He was slightly hypotensive, tightly tachycardic, and the pulse was feeble to feel. Okay, so with these features, we can come out with this following diagnosis: bleeding diverticular disease of the colon. Okay, differential diagnosis: angiodysplasia, carcinoma of the colon, and bleeding coagulopathy due to induced by Plavix. Okay, and we can grade the severity of the bleeding as mild to moderate in severity. This is due to the slight hypotension and mild tachycardia with feeble distinct. The rest, this patient is quite stable otherwise. Okay, so in severity, mild to moderate degree of bleeding. Next, we come to the 3 questions which I'll pose to you. What is the most likely clinical diagnosis in this patient? It is quite obvious. The diagnosis, provisional diagnosis in this patient is bleeding diverticulosis of the colon. Bleeding diverticular of the colon. The second question: how will you assess the severity of the bleeding? Okay, the number of factors will be taken into consideration. First, the age of the patient is quite elderly, 78 years old, old stroke and is on Plavix for the past 2 years. So these are pre-morbid risk factors which add severity to increases the grade of severity of the patient's bleeding. Next, the clinical parameters: BP, pulse, are slightly on the borderline, slight hypotension and slight tachycardia with feeble pulse. Oxygen saturation seems to be okay, and there does not seem to be any continuous bleeding. So the bleeding on examination could have probably slowed down or stopped. And in these patients, a measure of the hemoglobin and hematocrit may be of help. The parameters of the Glasgow, Blatchford and the Rockall scores can be adhered to reveal the severity of the bleed. So from these we can grade the severity to mild, moderate or severe. In this patient, most probably is between mild to moderate. Other than its borderline vital signs, the other factors seems to be quite stable. Next we come outline the principles of subsequent management of the patient. Okay, the first and immediate thing that must be done is resuscitation with IV fluids, and in this patient maybe blood transfusion as well, which need to be considered. Covered with PPI infusion to reduce the risk of stress bleeding, stress ulcers, and close monitoring of the patient's vital signs, saturation, urine output in preferably HDU, high dependency unit. Patient may have to be given supportive oxygen therapy. The next is, if the bleeding continues, then emergency colonoscopy might have to be done, considered. If this is not possible or the patient is not fit for this procedure, then RBC TET scan or a CT angiogram will be the other choice. In places where there's facilities, maybe a catheter embolization of the bleeding site may be undertaken. And if this fails, then surgical procedures should be considered. If the bleeding stops, which occurs in the majority of cases, then a colonoscopic examination should be done as soon as possible, within the next day or two. And if this does not reveal any bleeding, then a video capsule endoscopy may be considered. Thank you for joining me.